And so, Dr. Khan, so let's cut to the chase. So we've already talked about AI a little bit, but I'd really like to see your approach. Like what is AI doing to healthcare? Is it running it through like a hypercycle? Is it just hype? Is it real? Is it what are your thoughts on AI and where we're taking this in medicine, especially as a hospitalist? I really like to know this because we have to, have our fingers in every single little pot. So
Right, definitely. So we definitely are in hype. I'm not really sure we're in a hype cycle because hype cycle crashes. I think the hype is real. I think this hype is going to be emanating and moving into all spheres, so especially healthcare. And if you look at any projections, there was a projection by the World Economic Forum that by 2030, AI in healthcare will be a market of around $188 billion. So that is huge, and you cannot deny that in a way. So having said that, you have to have real use cases that actually bring value, and that's where people are getting at, and that's where healthcare will be going. And when you look at the future of medicine, AI is going to be part and parcel of it. Let's take a few examples. Um, uh, diagnostics, and that's going to be changing drastically. When DeepMind picked up and tested humans versus AI, it said that DeepMind was actually able to diagnose breast cancer better than physicians, and that was mind-blowing a few years ago. Move forward a couple of years, now you know that AI is reading radiographs. They can read thousands in a second, and the radiologist takes couple of minutes, and that helps me out and her out in the hospital when you're looking for that MRI report, and you're not too good at reading MRIs, and you need that report for that patient, and you need that quick. So nowadays, in the future, near future, you're going to have reports generated by AI, and the radiologist is going to just sign off on it, read through it quickly that hey, this is valid. um, Similarly, we had developed a colonoscopy lesion detection, and now the gastroenterologist usually has to go in, take pictures, put it together, put some notes onto it. So we had a program that, okay, you can detect a lesion. It can automatically tell you what it is most of the times. And the gastroenterologist basically signs off or makes some minor adjustments. These are use cases that AI is going to be used for. Then you have drug discovery. Now, you in the past you didn't know what the side effects of that drug would be or the bioavailability would be. Nowadays, you can use AI to do that within days or even sooner. That would have taken months to figure things out. Then, if you look at other aspects of AI, which will help our practice per se, is transcription. And I was on a podcast with a neurologist, and he had a program, Dr. Junaid. Dr. Junaid, I'm forgetting the full name. So he demonstrated during the podcast that I acted as the patient, and he was the physician asking questions. And by the end of the conversation, the note and the plan that was explained to the patient, including all the history taking, all the review systems, and everything else, and the physical exam findings were automatically turned into a doctor's note. And we know documentation is a second job for physicians, and you go home sometimes and you have to fill those up later in the day. So yeah, AI is going to be part and parcel of our practice as we go, and it may mean, and I would like to say, it may mean that we may need fewer radiologists or maybe even fewer hospitalists, and one hospitalist may be able to see many more patients instead of the 20 patients that we are currently set to target. And in the future, somebody like me may be able to see many more patients. So it will have a ripple effect on this whole economy. So yeah, there are many. Yeah, AI is here to stay, and I don't think it's just hype.
yeah, I mean, certainly creating, increased efficiency in how we practice. Right now, you could see as a hospitalist, at least, we'll see, 15 to 22 patients a day, depending on census. And, you might spend 5 or 10 minutes on one patient where you spend an hour and a half on another. So it's really variable. Things are going on, people are crashing, and some days you you just don't have time. And one of the burdens on the everyday, clinician, physician, so nurses, doctors, APPs, is documentation. I mean, it just sops up all of your time. And that's to, certainly satisfy the payer's needs. You've got to satisfy all of the, the guidelines. You've got to satisfy CMS, Joint Commission, all of those things, and make sure that you're still giving the best possible care to your patient. Like it's almost an impossible task. And so, much to your point, utilizing, AI resources, not chat GPT people, using AI resources, intelligent AI resources that help the physician, that help the average clinician, that speed up the process, that take the busy work out of all of the stuff that we have to, just document forever, you know, can definitely create, significant efficiencies in how we practice medicine. And hopefully, the result of that is spending more time at the bedside with the patient. I mean, that's what we all went to medical school, we went to nursing school, we went to, you know, tech school or, whatever have you. We went into our fields because we wanted to touch people, you know, whether it be physically, whether it be emotionally, whether it be medically, whether it be surgically, all of that stuff. And the current healthcare, especially in the United States, the way that it is, has gotten so redundant and so, prescriptive of how we're supposed to be practicing and what we're supposed to be documenting to satisfy, again, going back to the payer's needs, um, which I'd love to have Brian come up and speak about as well. And, you know, that it sops up your time and you end up spending so much less time with your patient, or you spend as much time as you can with your patient and in the back of your head thinking, I I don't have time to do this. I don't have time to eat. I don't have time to sleep. I don't have time to pee. I don't have time to, hydrate. Goodness, I can't imagine how many people in kidney failure half the time because we don't have time to even just do things like drink a glass of water in the middle of the day, because the healthcare system has become so taxing and what we have to do in the electronic health record space, especially. So having tools like these that speed up the efficiency of providers will not only improve the efficiency, provide hopefully more time at the bedside, but also decrease burnout. I mean, we're dropping healthcare providers like, like lead bricks. And some of these efficiencies, although scary, and we have to learn to utilize them in a very thoughtful manner and in a very responsible manner, with uh, power, what is it? The power is corrupts and something corrupts
Our
absolutely.
corrupts absolutely.
Thank you. Um, Terrible with those things. I shouldn't even say those quotes, especially in front of a large audience. But we
Absolute
have to be
power.
very thoughtful about how we roll out these technologies and make sure that they're not replacing humans, but working with humans to improve the face of our healthcare. So bravo, guys. This is awesome. Um, so I'm going to do a little bit of a round table now, and I'd like to just have I think we have what 10 minutes left in the panel, and I was hoping to give opportunity for people to ask questions if they'd like. But I'd like to just do a quick flash roundtable of kind of your final thoughts. Like, what would you tell the folks in this room, the folks listening, hopefully on the YouTube video? You know, what do you see in the future of healthcare? Where are technologies going, and what you would have to impart to them?
Yeah, so I'm actually optimistic, and there is a Chinese saying that may you live in interesting times, and actually that was as a curse if I remember correctly, and you can correct me if I'm wrong. We are living through interesting times, and I think these times are going to be positive for the healthcare side of things, positive in better patient care, better patient management, better outcomes, and that's what we are talking about right now. And everybody has their own sort of niche where they want to improve outcomes and improve patient care. I think that's what we're looking for in the future, and I believe we hopefully get there sooner rather than later.
With that, I would really like to thank all of my fellow panelists. You guys are rock stars. I am super happy to get to know you. I am very, very pleased that you're all doing exactly what you're doing in medicine right now, because I think that you are very, very much the emerging face of healthcare and healthcare specialties. And thank you guys very much. I'm going to open it up to questions if anybody has. And thank you all very much for being here with us. Now, I don't see any microphones, but I have a very lovely lady up here with her hand up.
Yeah, I definitely agree in a way that more technology is always not the best at every solution, but in remote areas, now we are getting to a stage where you may have internets, Starlink, perhaps other companies. Jeff Bezos is doing something similar. So that is going to come to be. And you had a very valid point that people may not know how to use technology, right? And I remember that when we were working on our remote monitoring for COVID-19 patients. So back in the day, they could be elderly. They didn't really know how to use an iPad or something similar. And you knew they will not be using that apparatus and machine. Now, and what we had done was we removed the patient from being able to, actually handle it much. So the doctors, family members, nurses could interact with the patient inside the rooms remotely from wherever they are, without having their much input from the patient, and they would interact as such. And families preferred that with their elderly people who are confused and debilitated. Um, Similar to the network, and is already transmitting. The patient does not need to actually press a button to put the recording in a mobile application. It can be all done remotely. So these things are coming in. Samsung has a ring. There's an Aura ring that is a very well-noted company that can track numerous aspects of the patient's vitals. So um, I think you can definitely find resources that can reach remote areas. And I think here maybe advancement in technology is actually going to help very soon in the near future. Yes.
And I certainly don't have an answer, an all-encompassing answer to that question. That's a very difficult, you know, uh, it's a very difficult problem to solve, right? Um, in the case of the wraparound centers, though, the first thing that comes to mind, at least in my mind, and in a lot of other rural areas, is sometimes leveraging lower level technologies. I mean, almost everybody has a cell phone, not necessarily a smartphone, but they might have a flip phone, a digital phone. So things like bulk, telemedicine, that you could leverage in those centers, certainly comes to mind. The patients can't do them in their own home because they don't have access to internet or cable or whatever it is. But utilizing those centers as a median and then cooperating with other centers and other organizations around the United States to provide some of those things like telemedicine services or even just phone consultations, to some of those patients. They might not still be getting the best face-to-face care, but they will be getting some care by hopefully a specialist. And even in larger healthcare systems, I mean, I work in Albuquerque, New Mexico, and half of our hospitals don't have providers. I mean, they have hospitalists, but we don't have ENT, we don't have neuro, we don't have, in some cases, goodness gracious, cardiology. I kind of feel like that should be a basic service for a hospital. And we're leveraging more and more things like phone consultations. We're leveraging email, even on secure HIPAA compliant platforms, and we're leveraging a lot of telemedicine services. So not an all-encompassing solution that also just as I can't remember which one of you had said, that might need a little bit more tech to actually pull off. But I think that finding a fairly simplified solution might be, again, not the full solution to your problem, but at least a help.
I want to second Chad. Uh, the future of healthcare needs to combine um, what humanity has learned over the past centuries. And not everything is, of course, perfect, but you weigh and consider what has reliable enough evidence, and you combine all of this for a more holistic management of the patient, and in conjunction with Eastern medicine, allopathic, whichever medicine you want, and combine it all together for a better outcomes.
Couldn't say it better. Thank you very much.